Hello, hi everyone, and welcome to Tuesday Tips with your Nurse Advocate Consulting. My name is Pam, and together, Linda and I, we are board certified patient advocates and registered nurses, each of us over 40 years of experience helping families just like yours. So, if you're a caregiver and caring for aging parents, or just starting to notice your loved one needs a little bit more support, you're in the right place. Today's question is one we hear all the time. How can I make sure my aging parents get the proper health care that they need? How do I navigate the healthcare system? How do I, make sure that they're getting everything that they need? Well, we're going to talk about that on this Tuesday Tips. We're going to talk about 6 tips, 6 strategies that we can share with you to help you ensure that your loved one is getting the best care possible. So, first of all, we want to say this. If you're feeling overwhelmed, worried, or even guilty, you're not alone. Navigating the healthcare system for your aging loved ones can be very confusing and stressful. Believe me, I struggled with it as well with my mom recently after a hospital stay. Linda's gone through it with her mom recently, and now currently with her dad. So not only do we have our professional experience and background caring for others, we're also in the weeds, so to speak, right along with you. So we're in the thick of things right there. And so we're also speaking from our own personal experience as well. So tip number 1, start with a comprehensive assessment. What do we mean by that? That sounds like a fancy medical term. But the first step is to really get a clear picture of your parents' current state of health. How are they doing? You need to schedule like a walkthrough at their home. Are their bills being paid? Is their house being kept up? Are they able to eat? What's in their refrigerator? Are you noticing any issues with pet cares? Are they missing doctor's appointments? We have one of our, in our free resource section on our website, one of our free handouts is 11 signs your aging parents may need help in the home. And they go into some of these and a lot more in detail that may give you some indication that things maybe aren't quite as right as home as you believe they are, or what your parents lead you to believe. So one of the things is schedule a thorough checkup with the primary care provider. Everybody gets through, Medicare age. They get a annual Medicare wellness checkup that is covered 100%. And if you try to attend that with them, oftentimes our aging loved ones don't recall or don't remember a lot of what's being said during the appointment. So if you're working or you can't attend the doctor appointment, what we do all the time with our clients is they call us on the phone when they get in the doctor's office. They put us on speaker. I introduce myself, and the doctors are very gracious about a support person listening in for the doctor appointment. It helps them ensure that, there's a couple of different people and we would take notes, or if you can take notes, so that you have firsthand knowledge of what's going on and what they should or should be doing. Now, they get a summary of their visit afterwards, but it's not to the degree of detail as it is when you're actually listening to the doctor talk. So I highly encourage you to attend their annual appointment with them, either in person or virtually. Another thing is that, review their medications. Ask them for a list. Are there any duplicates on there? Do they have lists that includes everything they've ever taken? We want to make sure that there's a current list of all their prescription medications. Now, this includes any supplements they're taking, any vitamins, garlic, vitamin A, vitamin D, any kind of supplements that they're taking, because that's very important. We think that vitamins and supplements, are all good. And I'm very much pro holistic as I can and see the value in some of these things. But you need to remember that, especially in the herbal category, some of these herbs type supplements can interact with medication. So it's really important that you list all the supplements you're taking besides prescription medications. The other thing is, request screenings for common age-related issues. When was the last time they had an eye exam? Have they had a hearing exam? What about a cognitive eval? Checking their memory, and also, mobility. You can get a screen through a physical therapist, see how they're doing, and just trying to get an overall feel for where they are at right now with their healthcare, so that what some of the directions may be that you need to follow up on. So one of the pro tips that we suggest here is we've got also, it's another free download in our free resource tab of our website, but we've got it an emergency to go folder, checklist, and guide. So basically it is, you can print off, it's a fill in the blank thing, set of sheets. They have all the information, medications, allergies, who your doctor is, your contact information, emergency contacts, everything that you would need, that they would need to take with them in an emergency. So for example, if you have a solo aging parent, say a mom or a dad that's living alone, and something happens and they call 911. By the time 911 gets there, they're not real coherent. They don't know anything about them. If they have this emergency to go folder, they could look and see diagnosis. They can see medications they're on. It may help them be able to treat them quickly, and versus just shooting, going blind and trying to establish what the symptoms are caused from while they're on the way to the hospital. So that could be very handy if for some reason, your aging loved one is not able to articulate all the information that they need. This way in a folder, it'd be all in one place. So here's tip number 2. Build a collaborative care team. No one has to tackle this alone. Even if you are an only child, there are other, we do have another resource on building a care team on a budget. Lots of ideas looking at your circle, your parents' circle of influence, and what other people may be able to participate in their care. So we want to, and with this collaborative healthcare team, we want to look at the key players here. So we want to look at, who are the doctors, who's the primary care provider? Are there any specialists involved? What's their pharmacist? Are they getting any home health or any specialized treatment or care? And don't forget the non-medical helpers. Are their neighbor, friends, or community? Someone coming in and helping them, bring them meals? What all is going on in their world that is keeping them safe at home, or keeping their healthcare needs met at this particular time? We talked about attending the doctor appointments. And so it's real important to get a feel for who all are involved in making things. I mean, maybe they have a neighbor that checks on them a couple times a day, and maybe you didn't know that they're requiring someone to check on them a couple times a day. So these are the kind of things that you want to get a good handle on when looking at making sure that your aging loved one gets the care that they deserve. Another thing, so tip number 3 would be just keep the lines of communication open with you and your parent and their care team. I suggest that you get access to their MyChart. All they have to do is give you permission. You can get your own login and sign in so that you can access their MyChart. You can send the doctor's messages. You can see blood, lab results, diagnostic tests. You can see the notes from the providers after they see a visit. So that is another good way of staying on top of things. Plus, you get to see their appointments, what's coming up, and to help them remember to make sure that they get to those appointments. So after each doctor appointment, make sure that you're clarifying the next steps and following up on any action items that need to be taken after that doctor appointment. Don't be afraid to ask questions. Use a notebook if you're attending a doctor appointment, or talking to your aging loved one on the phone, or you're talking to another part of the care team. I have a notebook on my mom. I have a notebook and a folder on her with all her information. Every time I talk to someone regarding her healthcare, I make notes so I can make sure that I inform my siblings and we're all on the same page. Everybody knows what's going on. So don't hesitate, to take notes. And the biggest thing is when it comes to the healthcare team, whether it's a provider, a pharmacist, physical therapist, whatever, please don't be afraid to ask questions. There are no dumb questions when it comes to your loved one's health, especially if you don't understand, if they're using language or lingo or medical abbreviations or, things that you don't understand. It's okay to say, hey, I didn't understand a thing that you said. Could you just explain it to me in layman's terms or in English, please? We have another free resource. We have our prep for the doctor appointment, and that's another sheet. It walks you through some tips and strategies to make sure that you're prepared for the doctor appointment, giving you space to be able to write down what questions you want to ask. Sometimes, sometimes, not always, but sometimes when you go to the doctor appointment, sometimes you may feel rushed. Doctor may, maybe he or she has a busy day. Maybe they have a packed schedule, and maybe you feel like you're being rushed a little bit. And so by having these written down, you can save them time and save yourself time, because you just got to look at your little cheat sheet, your prep for the doctor appointment sheet, and you'll be able to have everything, the information, all there right for you. You can even hand that to the doctor if you want to and say, hey, could you address these for me before you leave? And so, that's a great resource. We have that on our website, yournurseadvocateconsulting.com, and it's just under the free resource tab. All right, let's move on to tip number 4, planning for emergencies. So first of all, emergencies happen. The older we get, the more likely there's going to be a medical emergency at some point in time. And being prepared can make all the difference in the world. So we talked about our emergency to go folder. We talked about having an updated medication list, medical history ready to go. There's another Braddock advocacy and consulting service. She does a great kind of a program on creating a medical binder, which is different from our emergency to go folder. Our emergency to go folder is just a folder that's got all the things you need in case you would need to go to the emergency room, whether you're traveling or whether you're home. The medical binder, actually, Barbara walks you through creating basically a virtual chart of all your medical history. So if that's something you're interested, just look at Braddock Advocacy and Consulting. Barbara Gaynor has a great tool for you there. Know where the nearest hospital is and what insurance covers. A lot of people have a copay for an emergency visit, but then there's other charges. So know what the insurance is, know where the preferred provider is. You want them to go a place where their services would be covered. Now, mind you, most insurance companies, if you're out of your service area, you're on vacation or you're traveling and you have an emergency, more than likely that there's not going to be an issue with your insurance covering you. But if it's, for routine care, or you're going for a test. I had a client who struggled to get into behavioral health, and she found a clinic, and they sent authorization to the insurance. They never got it back. They started seeing her. She got this big bill in the mail because the auth process wasn't complete. And that was one of the things that we talked about, that I was really worried, is when you're going outside of your clinic, going outside of your system, a lot of times your insurance won't pay. It'll be treated as out of network. Either you'll have a higher copay or they won't cover it at all. And now she's got this big bill that I don't think that she's going to be able to recoup on that. And so we worked through that. I got her back in with her own system, and she's making some arrangements to get some visits there. So you got to be aware of the insurance and what, otherwise you may get stuck, or your loved one may get stuck with a big bill. The other thing is planning for emergencies is discuss advanced directives. A power of attorney, living wills. Do they want CPR? Do they not? What do they want for their advanced directives? And, the decisions are a lot easier to make when you know what your aging loved ones want. So if everybody knows your parents' wishes, then things go a lot more smoothly, and we need to have them documented in writing for the healthcare providers, the paramedics, and also for emergency room, as well as the hospital and clinic staff. So tip number 5, educate yourself and your parent. So knowledge is definitely power. So say, for example, they have a chronic health condition, say diabetes, heart failure, or dementia. Ask your healthcare provider for educational materials. I caution, in the hospital, we kind of joke and we say, oh, everybody checks Dr. Google. And so I encourage you, if you're going to be searching online and doing your research, just make sure that you're going to reputable sources, and do your diligence and ask your healthcare provider, social worker, the nurse at the clinic, ask for educational materials, or check out, we have a lot of free resources as well. So you want to learn as much as you can about that so that you can support your aging loved one and you can help them on their journey of keeping that chronic health condition in check. Also, encourage your parent to be part of the conversation in their care. As our aging loved ones age, they feel that they're losing their independence. Well, we want to keep them as involved as possible. Decisions are so much easier when you know what your parent is thinking or what your aging loved one is thinking, on top of, what they want and how they want their healthcare. I mean, you may want them to have this big workup, and they may say, you know what, honey, I've lived my life. I'm content where I am. I really don't want to go through all of that. Well, we may not agree with that, but we just need to be able to respect their wishes, because if they're of sound mind and can direct their own healthcare, sometimes, they have the right to make their own healthcare decisions, whether or not we agree with them or not. We just need to find a way to be able to be supportive. So the last tip number 6, is taking care of yourself. Caregiver burnout is real. It happens all the time. Your heart is in the right place, but it's physically and mentally exhausting. So one of the things that you need to do in caring for aging loved ones is don't be afraid to set boundaries. So setting boundaries, asking for help. I say this, I've said this in many, many Tuesday tips. Asking for help and realizing, your weaknesses or that you need help is not a weakness. It's actually a strength. It's a strength to be able to recognize when you are at your limit and you know that you cannot do any more. Because if you keep doing more, you're going to push yourself possibly to the point of no return. And so recognizing that you're at your limits is a strength. So please make time for your own health. One of the easiest things to do to try and take back some control of your time when dealing with aging parents, oftentimes they call a lot. They may call and say, well, I really don't know why I called. I don't remember, but they could be lonely. They could be, have a question that they really forgot. So one of the things that I suggest is very easy for families to do is schedule check-in calls. This will help avoid interruptions at work. It will help avoid interruptions at inopportune times. And so whether or not they need one check-in call a day, 2, 3, 4, that's up to you and what you assess your parents' needs. But then know that other family members, church family, neighbors, other relatives and friends can also participate in those check-ins. And this way, if you're, say worst case scenario, you're calling them in the morning, noon, supper time, and bedtime, for reminders or to make sure they're okay, that's 4 times that they're getting contacted and talked to, which means unless it's an emergency, they're less likely they're going to be calling you in between those times because their needs are being met. So it's okay to set boundaries and it's okay to do those things because you've got to take care of yourself. So let's recap. So the 6 tips were, know your parents' health conditions, do a kind of assessment, do a walk through the house, see how they're managing, see how they're doing. Build a collaborative team. Again, this could be family, neighbors, church family, friends, any of that, any support people that are willing to help. Tip 3, communicate clearly and often. Make sure that everybody is in the loop about what's going on and everybody is communicating that back and forth. Number 4, plan ahead for emergencies. Number 5, make sure you're educating yourself and your parent on any chronic health conditions or things that they need to be managing on an ongoing basis. And then last but not least, and probably one of the most important, is don't neglect your own well-being. So remember, you don't have to do this alone. If you'd like more personalized support, please check out our free resources, join our Senior Saturday newsletter, or if you've got immediate needs, please, book a 30-minute free consultation with us. We promise you that whether or not you use our services, you'll walk away with 2 or 3 action items that you can take action on right away, with your unique particular situation. I'll put the links in the description of the video when you catch the replay. I'll put it here on Facebook, and also subscribe to our YouTube channel. We have hundreds of videos that you can go back and look and just search for a particular topic. So we'd love to hear from you. Suggestions for future topics, comments on what we've talked about, something that works for you, a tip that could help our community. Drop the questions or comments in the comment section. We'd love to hear from you. And we are here to help you. You are doing an amazing job. Kudos to all of you that are caring for aging loved ones. It is truly a labor of love. And, you're doing an amazing job, even on the hardest days. So we're here to help you navigate your journey with confidence and compassion. And we will see you next Tuesday for some more Tuesday tips. Take care, and we'll see you soon.